Do we have the numbers by chance of what is like the relapse rate?
It's very high.
Is it high?
So yes, that's a good question. So generally, if somebody is addicted to prescription meds or illicit drugs, or even gambling, sex addiction, other types of like overeating, etc. Generally, but specifically when it comes to alcoholism and substance use, without any treatment, relapse is huge. Is 99%. People just relapse. That means they continue, even if they stop on their own strong will. Like after maybe they can stop for a few days. Some people can venture out and do actually a few more, like a couple of weeks, maybe a couple of months. Some people are really brave and there's a life-changing event in their life that kind of propels them, compels them to really stop for a couple of years. But then another life-changing event can take them back. But ultimately, there's always relapse. Basically, 99 to 100% of addicts who don't do anything about this addiction, they always relapse. That's how, more or less, the addiction continues, right? Because, and I put it in this framework rather than saying, well, an active person in an active phase of their addiction, they always plan on continuing the use. That's not always the case. Because of those side effects. You see, when people go through these ups and downs of their active addiction, they hate it. It's not like they're planning to continue that harmful, painful experience of addiction. They're not planning that. They would love it to stop, but they just kind of are helpless toward it. And that's that disease phenomenon, because an addict's brain is dysfunctional. It is, in a disease state. You can't rationalize or think or reason correctly. You can't, right? Therefore, in their active disease stage, they are simply overwhelmed by these repeated urges to fall back into those escape mechanisms, escape from pain. So that's why I mentioned that relapse in that state is very, very high, because they don't actively plan to continue their addiction. They hope and try to get out of it, but it doesn't work. So ultimately, every few days, every few couple of weeks, every few months, they relapse. And they don't do anything about it. Now, when we change that into, let's say, the next stage of recovery, which would be a simple, mere 12-step model, okay? If a person decides, you know what, I'm going to go to AA meetings from now on. I'm going to take that route and nothing else. So I'm not going to seek therapy. I'm not going to get medication to replace my substances. I'm not going to go to a treatment center. I'm not going to go to a recovery center. No, I'm just going to go to weekly or daily AA meetings. The chance for them to relapse is 90%. 90.
Wow.
Only 10% of individuals, more or less, kind of a ballpark, the 10% of individuals who only utilize AA meetings can remain sober for the rest of their lives.
Wow.
Only 10%. Now, if you add another component to it, and add another of these tools out of the toolbox, then the chance increases. So, for instance, let's say you add in therapy. If they do the AA meetings on a daily basis, but also they seek individual therapy, the chance can go up to 40-50%.
Wow, that's a lot.
Yes,
It's a big change.
Yes, and then you that's just individual therapy. Well, and it depends on what study you're reading. Some studies show 20%, some show 60%. But on average, it's known about 40% on ballpark. So it goes from 10% to 40%. 40 out of
jump.
10, or 40 out of 100, or 4 out of 10 people can remain sober for the rest of their lives, given only these two components: with daily AA or NA or 12-step meetings and individual therapy. Now you add family therapy to it, it increases even more. I don't know exact numbers, but it goes to up to 60%, 70%. And in fact, for dual diagnosis cases, where the issue is not just substance use, but there's an underlying condition such as past history of trauma, abuse, or current depression, or bipolar, or let's say psychosis, or other types of ailments that are present. It could even be a medical condition such as hypoglycemia, or diabetes, or cardiovascular problems, blood sugar level deficits, autoimmune system, pain related disorders like, let's say, fibromyalgia or MS, or even age related problems such as, let's say, dementia or Alzheimer's. You add, and then personality, more or less longer enduring personality traits.